Hello, my name is Dr. Laurie Beard. I'm at Kansas State University, and I've been asked to give a short talk on an update of vesicular stomatitis virus, in particular in Kansas. As many of you know, let's see if I can get my slides to advance. Here we go. That we did have an outbreak in Kansas. It was a pretty large one in Kansas with vesicular stomatitis virus, and that initially happened on June 17th, and that was reported in Butler, Kansas. And that eventually resulted in 26 counties in Kansas having farms or premises with VSV on those. And most of the counties were in the southeast. I know the year before we did have a county out on the Kansas-Colorado border. This also included Riley County. We actually had a horse in our teaching horse population that had VSV or was diagnosed with VSV. So the name of vesicular stomatitis virus, it's named vesicular because of the vesicles or kind of blisters it produces. It is the only virus that results in vesicles in horses. In cattle, we see more than that. And this horse, we see these vesicles have ruptured and resulted in ulcers along the lips of the mouth. This is a more severe case. You can see that some redness, ulceration on the lips, also on the gums. And you can imagine that this might be pretty painful. So some of the initial clinical signs that you might first notice is maybe a horse that's off feed, maybe not eating, maybe not drinking, and drooling excessively. The other thing that you can see on some of these horses are these coronary band lesions. And so this is a horse with a mild coronary band lesion. Dr. Andy Hawkins, who works at the Department of Kansas Agriculture, he's been quite helpful in answering a lot of our questions, but he did report that some of these horses with these coronary band lesions were significantly lame and resulted in some problems, trying to get over that. Other places that you can see lesions would be the sheath and the mammary glands. The other thing, again, this was Andy Hawkins' comment that he's seen it in the pin of the ear. And this was our teaching horse. She's named Reba. And this was August of this summer. And somebody noticed that she just had this ulcerated area along the pin of her ear. To me, it might look like, gosh, fly strike or fly irritation. Maybe a little bit more extensive. Reba didn't have any other really lesions on her mouth. She wasn't running a fever. She didn't know she was sick. But anyway, because of this, we brought her into our isolation facility, and we had Dr. Hawkins come, or he came and tested this, and this was positive for vesicular stomatitis. Other things that you can see, so some horses will have a fever because of the mouth ulcers. They're certainly maybe not going to be eating all that well. Drooling would be the other complaint, and certainly weight loss might occur. So vesicular stomatitis can also affect other animals, and most notably cattle. Cattle can get other viruses that look similar. Less commonly, we'll see this virus in sheep, goats, and alpacas. And in humans, especially the humans that are handling the animals with these ulcers, because the ulcers are shedding virus, potentially can get infected and have flu-like symptoms. So it's important to remember, if you have any horses on your place next summer that might have this, is to wear gloves. Again, with cattle, we can see this. The disease looks very similar to another disease called foot and mouth disease. And foot and mouth disease is not in the United States. It's a reportable disease. It's extremely contagious, can travel over miles. And it's always a worry that we'd see it in the United States. And these diseases that cause ulcers, the biggest concern is the production aspect of it, because these animals aren't going to be eating, they're not going to gain weight, they're going to lose weight. Certainly in dairy cow, decreased milk production would be a concern. And that's probably why this virus is important as far as the regulatory aspect. So we see this disease in the summer and fall. We see it in that time of year because we know this disease is transmitted by flying insects. And so sandflies, black flies, and culicoides have all been implicated. Certainly the animals that have the ulcers, you can spread it by direct contact. So if they're drinking water and another horse, livestock comes up and drinks water behind them, certainly that would be a way to get it. Certainly if you're handling the horse with the ulcers and you go to another horse with ulcers, can certainly be done doing direct contact. It seems to be outbreaks we see on waterways, and it's probably, again, related to probably that insect vector, with insects probably breeding in water. The animals survive, and the treatment is pretty supportive. And I mentioned with our teaching horse, like I said, she didn't even know she was sick. So if necessary, we might use some things like butyrobanamine to keep them comfortable, make sure they're eating and drinking. If it was really severe, I suppose you could go with oral fluids or you could go with IV fluids. I did mention the horse that had those coronary band lesions and dealing with that. And again, most of these animals are going to survive. So what's the big deal? I mean, why even talk about it? It is a reportable disease. So if a veterinarian sees an animal that has potential clinical signs with VSV, we're supposed to absolutely call our state vet office. And probably the real implication is the concern in livestock, particularly cattle, with decreases in production and loss of economic revenue. And the other big thing, at least for horse people, is when we're having an outbreak in our state, it's going to have implications on our ability to take our horses to shows, trail rides, whatever it may be. Certainly, it will have implications on also moving livestock. So as far as regulatory rules, again, if we see clinical signs consistent with VSV, we're supposed to notify the state vet. State vet will actually come himself, him or herself, send maybe somebody else, take a look at the horses, say, yes, do they have clinical signs consistent with VSV? And if they do, what they're going to do is they're going to tell the farm, you're quarantined. We're going to go ahead and test your horse. And so, and then they're going to wait until test results come back. And as far as testing, there's a couple different ways to do it. One is they're going to actually test the ulcerative lesion. So usually it's a swab. They're basically looking for viral DNA. The other thing that they may do, as well as do a blood test, and they're going to look for serology. So is there an antibody response? So if this test comes back positive, then you'll get a phone call, probably a letter, and saying, hey, guess what? Your horse is positive, that farm, your premise is going to be quarantined for 14 days until after the last animal is sick. Well, what does that really mean? So if you have 5 horses and your farm's quarantined for 14 days, and at the end of the 14 days, so day 15, nobody else is sick, you're going to get notified that your farm is out of quarantine and you're free to move your animals around. However, if you have 5 horses and on the 13th, 14th day, there's a second one that gets sick, that quarantine clock then starts again at 14 days. So you'd be quarantined for a total of 28 days. You can imagine if you have a large boarding facility, 30 horses, 40 horses, and there is some time delay between the animals getting sick, and maybe it's 5 days, 10 days between a horse that gets sick, potentially your farm could be under quarantine for a pretty long period of time. So here's some of the confusion. So in Kansas, the Department of Agriculture, we're only going to quarantine that affected farm. There is nothing as a 10-mile radius rule, like we're going to quarantine other farms in that 10-mile or 5-mile radius. It's only that premise. Now, different states are going to have different rules. And I would say that there was significant confusion regarding this particular statement, where we'll show you some examples where people and even veterinarians were confused about, gosh, my next door neighbor 5 miles away from me is quarantined with VSV. Can I take my horse and go to that show or that trail ride? So for example, your facility, you have your horses are fine. There's no suspicion or concern that your horses have VSV. However, your next door neighbor 5 miles away from your place has been confirmed to have VSV and is under quarantine. You want to take your horse to the show or that barrel race at the Expo Center in Topeka, Kansas, and the answer is, can you go? The answer is yes. And again, that would be with a caveat that your horses have no clinical signs of VSV. The other example would be, how about you want to go to a show or event or a trail ride out of state? So again, the example of your horses are fine, your horses have no clinical signs. However, your next door neighbor 5 miles away has a confirmed case of VSV. So you're going to obviously need health certificates, or you're supposed to get health certificates to travel to a different state. And the question is, can you go? Can your veterinarian write a valid health certificate? And the answer to your question is, I don't know. What I would do in that situation is I would get on the phone and I would call that Department of Agriculture for that particular state. And I'm even going to say if we in Kansas are having cases of VSV, and again, even if there is no next door neighbor close by, I'm still probably going to get on the phone and talk to those that state veterinary office to find out what the rules are. So for examples, I do believe that last year Missouri did have that 10-mile radius rule. So if again, you're planning to travel to St. Louis, Missouri for a show, and your next door neighbor, again, quarantine positive, Missouri may say, you know, we're not gonna accept a valid health certificate in that situation. The other example of how things changed, Nebraska, because we had our outbreak of VSV, even though they were having an outbreak of VSV, they required a permit from horses from Kansas traveling to Nebraska. So that did require that once I got the Coggins back and I'm getting ready to do my health certificate, before I can finish my health certificate, I needed to call Nebraska to get a permit number. And so again, veterinarians need to call. I also discovered, thankfully, when I was writing some health certificates at the end of the day at 7 o'clock at night, that there was somebody still answering the phones in Nebraska to give me a permit number because, you know, sometimes people are leaving after 5 o'clock or early the next morning. The other thing is that some states may require special statements on that health certificate. For instance, your horse does not have any clinical signs of VSV. We may be more adamant at actually recording temperature, that sort of thing. So most importantly, if we're having an outbreak of VSV in Kansas of next year and you're traveling out of state, either you or really your veterinarian, if they're writing those health certificates, need to call that state and ask. The rules change fast. And I would say even what's up on the website is not going to be up to date. And often when I do it, when I call, I ask who I'm speaking to and record that. Just again, making sure that I've got that statement and I can write a health certificate. So the other thing that can happen as well, again, if we have another outbreak, it will certainly have an effect on our ability for international travel. And the most common type of international travel would be horses and livestock traveling to Canada, right? And so I do know last year and even the year before it, that Canada made a statement that because of VSV in Kansas, they were not allowing horses to travel from Kansas into Canada when we write our federal health papers. And so again, it's just something to kind of keep on your radar. So as far as summary, most of us have horses because we like to do things with them. So you need to be aware next summer of 2021, what's happening in Kansas. And again, that would be from everything from your next door neighbor who could have an outbreak to horses in your county, or even just in Kansas in general. Are we having any cases in any counties? Making sure your veterinarian calls before you travel, before they write those health certificates, and asking what the current state regulations are, because again, they do change. As far as places to check, here is a website. This is specific for vesicular stomatitis on the Kansas Department of Agriculture. If anybody, I'm sorry I can't be there today, but if anybody has any particular questions, here is my email. The other thing that's easy to do is just calling to find out. And the other thing to just kind of go back to regulations, I know some people sometimes we don't plan well in advance, and sometimes you need to get that, I don't know, the Coggins done with, very fast, or the health certificates done very fast. But just even planning ahead, having your veterinarian out there. There have been some states that have required the health certificate be done within 3 days of travel. And that's not typical, but that would certainly have an implication on when you want to schedule your appointment for a Coggins or a health certificate, that sort of thing. And again, probably checking with that state. So anybody has any questions, I'd be happy to answer them on phone or by email. Thank you very much. And we will go from there.